The irony is that the more kids breathe through their mouth, the more their nose is going to get stuffed up, which of course means they're more likely to breathe through their mouth. And this cycle actually becomes a learned motor pattern too, which becomes a big challenge to change because we like our patterns and habits, and mouth breathing can be one of those patterns or habits.
Welcome to the Baby Sleep Connection, a podcast that explores baby sleep and more through the lens of attachment and development. I'm your host, Heather Boyd. I'm a mom of 3, an occupational therapist, and a certified infant and family sleep specialist. If you are a tired parent who wants to support your baby sleep holistically, keep listening as we delve into approaches that go well beyond the usual strategies of wake windows and bedtime routines. Your baby's sleep is connected with so much more. If you're an allied health professional or healthcare provider working with families of infants or very young children, you've probably come across families who are really struggling with their baby's sleep. But like most healthcare professionals, you're probably short on time, lack the resources, and you don't have a credible source of information to go to. The Foundations of Infant Sleep for Allied Health Professionals is my answer to those challenges. This is a 2-hour workshop, both live and recorded so that you can go at your own pace, where we go through the development of sleep, the evidence to support the various strategies to support sleep, and how you can help your families navigate this stage of parenting and this stage of infant development. Learn more by going to familysleep.ca/professional-workshop. Hope to see you there. Hello, and welcome back to the Baby Sleep Connection podcast. I'm your host, Heather Boyd, occupational therapist, mom of 3, and infant sleep coach. Gosh, after taking 2 weeks off for Christmas, I'm a little tongue-tied over my own role. But today's topic, coincidentally enough, does relate to the tongue and the mouth and the airway overall. We are talking today about obstructive sleep apnea. Now, this is a topic for which dentists get intense additional training. There are specialists out there who are focused specifically on this issue and then narrowed again down to pediatrics specifically. So what I am covering today is a very broad overview, particularly since this year or this past year, 2025, I was seeing more children in my private practice who required exploring their airway as one of the contributors to poor sleep. We're going to walk through why it's important to address obstructive sleep apnea, what signs you might see that would suggest that you explore this with your healthcare provider, and then quick checklist to run through to make sure that you are covering all the bases in the event that obstructive sleep apnea and airway are contributing factors to really poor sleep. Now, most of you who are listening because sleep is a challenge. For most of my clients, that challenge is about development. That infant sleep is a slow developmental process. It takes time for it to mature, and that frequent interruptions and a lot of support to get back to sleep are normal. However, it is not always developmental. Sometimes it is related to a medical issue that needs to be addressed to clear the path for any of the holistic attachment-based strategies that I tend to rely on heavily in my practice for them to work. You could be the most nurturing, responsive, in-tune parent in the world. And if airway is a problem, you are not going to get very far with better sleep or longer stretches or moving past the crankiness that comes with a baby who has slept poorly through the night. I will add as well, of course, that if obstructive sleep apnea is part of your own sleep journey, or the sleep journey of that other human being who's lying in the bed next to you at night, and I'm not talking about your child, addressing this becomes paramount to everyone having good quality sleep and therefore good quality of waking hours, good quality of life. So let's get started. We're going to start with talking about why airway and pediatric obstructive sleep apnea matters. Why is this even important? Let's start with the definition, though, of obstructive sleep apnea. It is an obstructive event, so a blockage in the airway or partial blockage in the airway during sleep. And that blockage is in the upper airway. So it's not like a lower respiratory infection. It's not the blockage that comes from a respiratory infection, upper respiratory infection. It is an obstruction of that airway to bring air into the lungs during sleep. The key impacts of OSA, or obstructive sleep apnea, on sleep is that it tends to make sleep very fragmented. The body likes oxygen, and if you have an obstructed airway that gets interrupted, the brain is going to pull the body out of sleep frequently to make sure that everything is okay, that there is air in the room, that they are positioned in a way that creates an open airway to get air into the lungs. The impact of that lack of air is that there's a drop in oxygen blood levels. And of course, with that comes physiological stress of repeatedly trying to make sure the body is getting enough air. That means that there are often frequent pauses because of the apnea. And then the body tries to catch up by doing a huge in-breath, almost like the breathing will pause or stop, and then a big, big, big disruptive breath. When that happens, even if the person thinks or the child appears to still be asleep, when you look at those curves of light sleep and deep sleep and that REM sleep, that dream sleep, when you are constantly having hypoxia or an interruption in the airway and it disrupts the wake sleep patterns, you're not going to be having that nice curve of dropping into deep sleep and then rising into REM and then dropping back into deep sleep. With those interruptions, it means that the quality of sleep that a baby is getting or an adult is going to be poor. And so even if it looks like baby is sleeping through the night, it will be much more fragmented sleep. Now, of course, as I mentioned at the top, fragmented sleep is part of the natural unfolding of sleep maturation in infants, which complicates matters because so often I see parents knowing that sleep interruptions are expected in the first year and beyond, and that frequent wake-ups and a need for support are normal. But when it is caused by OSA, or obstructive sleep apnea, that fragmented sleep is actually making kids crankier than they need to be. We know that that is where the implications or the impact happens in terms of development unfolding. And I'll give you an example. I know parents become very worried when they see the news headlines about the link between poor sleep and ADHD. And there is a strong link, and we're going to explore that link in a little bit. But in normal sleep interruptions of a developing brain where we want babies to wake up often because it is protective, that is not poor quality sleep, at least for baby. It is for parents because we like our longer stretches, but for baby, it's fine. It's when those interruptions are due to airway, where normally that sleep cycle would be playing out, and then baby may or may not need support between sleep cycles. When we have this fragmented sleep because of airway, we're going to have a higher incidence of ADHD. In fact, some estimates are that 1/4 of kids with ADHD may actually have obstructive sleep apnea because the symptoms of the behavioral symptoms of obstructive sleep apnea chronically over time are quite overlapped with ADHD. The long-term stakes are pretty high because when we don't treat it, there's a chronic deficit in sleep and a chronic deficit in that important sleep cycle that allows the brain to clear out toxins to store new learning into long-term memory. And that's going to lead to challenges potentially with learning, less than optimal brain health, poor daytime functioning because kids are going to be tired, certainly crankier when they get up and crankier through the day. And with that, of course, comes the tendency for if kids are going to have meltdowns, those meltdowns are going to be bigger with sleep deprivation and interrupted fragmented sleep than they would be. Now, again, meltdowns and big feelings are a normal part of growing up. It's part of how our brain matures towards being able to self-regulate. These feelings are going to be big for kids, but they're going to be bigger and more difficult to move through when the reason is that sleep is fragmented because of obstructive sleep apnea. Things like attention, executive functioning, for school-age children, school performance can be lower. Now, if school performance starts to drop out of the blue, it's kind of a clear marker to look for something that's happening. But sometimes kids have had OSA for quite some time, and the school performance piece isn't dramatic because they've always struggled. And so it's worthwhile knowing what symptoms to look for. And we're going to look through that in a little bit. But I wanted to point out one study that really highlights how important this is. This is for school-age children. Again, I realize it can be really challenging with younger kiddos. But with school-age children, there was a study in the 90s that looked at taking the bottom 10% of school performers. So the kids that were getting the lowest 10% of the grades. If you took a class, who were in the bottom 10% for school performance? They were assessed by an ENT. Those that were identified as having enlarged adenoids or tonsils, they were removed, and then they were retested. And I think they were retested within the year. So not right away, but within the year, none of those kids who had been identified as having enlarged adenoids and tonsils that would have resulted in a compromised airway had remained in the bottom 10%. That means they were struggling with school because of their airway. And this is why I would argue for the importance of screening and early referral for kiddos and infants who may have obstructive sleep apnea or something going on with their airway. Because again, all the attachment strategies and all the knowledge around normal sleep development isn't going to fix an airway. So let's talk about the signs to look for. And I imagine some of you are like, okay, Heather, just give me the signs. Like, does my kid potentially have OSA or does my baby have OSA? There are a variety of signs during the day, during feeding, during nighttime. I'm going to focus first on nighttime symptoms or signals, then daytime, and then a few other red flags that are going to come up on exam. But at nighttime, you're going to hear loud and frequent snoring. Now, it might not be every night, it might not be all night, but it's loud or frequent and pretty persistent. Now, I say frequent without wanting to throw you off of this path of exploration with your doctor if they're only snoring sometimes, because there are kiddos who are very good at accommodating any restrictions on the airway. You might find these kids tipping their heads really far back to keep their airway open. In fact, it would look the same as a kiddo that has reflux that's trying to lengthen their airway to reduce the pain of that acid coming in. It can also open up the airway quite a lot. You may hear a lot of gasping or choking or even see those pauses in breathing. Kids with OSA often are very restless sleepers. They wake up frequently. They might be sweating a lot at night. For the restless sleepers, I know if you've worked with me, you know that we also look at nutrients in terms of contributing to restless sleep, like magnesium and iron that tend to, when they're low, result in restless sleep. But the airway itself can be causing that restless sleep, interrupting that normal sleep cycle. So what are you going to see during the day when this is an issue? Well, you're going to see excessive sleepiness, at least in school-age children, but you might also see hyperactivity because kiddos, very young kiddos that don't have enough sleep are going to get a little bit silly. And school-age children, it may show up as attention deficit disorder and some hyperactivity. They may be really difficult to wake in the morning, even though you keep a very consistent routine. They may fall asleep during the day when things are quiet and mellow. They haven't had enough sleep at night, so their body is pulling them into sleep. That sleep pressure is high, and it's pulling them into sleep during quiet activities, which would include, by the way, the car, which I know is a place that a lot of my movers and very sensory kiddos tend to fall asleep better in. A lot of this is going to overlap, of course. It doesn't mean that if your kiddo falls asleep easily in the car that they have obstructive sleep apnea, but it's something to consider. That hyperactivity, difficulty focusing, very disagreeable or less cooperative or less adaptable. This all can really mimic ADHD. And I think with how common that diagnosis is, it's really worthwhile ruling out airway when it comes to the hyperactivity and difficulty with focusing and learning. Daytime, you might also see mouth breathing, where their mouth is open at rest and they're breathing through their mouth. With that comes chronic nasal congestion. So the irony is that the more kids breathe through their mouth, the more their nose is going to get stuffed up, which of course means they're more likely to breathe through their mouth. And this cycle actually becomes a learned motor pattern too, which becomes a big challenge to change because we like our patterns and habits, and mouth breathing can be one of those patterns or habits.
Babies may also have a poor appetite for moving into solid foods because chewing or swallowing can be difficult with an airway that requires mouth breathing. The red flags that might come up during an exam are, as I mentioned, those large tonsils or adenoids. If your kiddo is getting frequent ear infections, that can be a red flag. Craniofacial differences as well, so a really narrow palate or a very small or retracted jaw can also be signs. I've mentioned daytime breathing, but also with the feeding part, there may be failure to thrive or really some challenges with getting on that growth curve. So kiddos that are falling off the curve are not growing at the pace we would expect at this age. It doesn't mean they have to be in the 90th percentile. They could be solidly and consistently in the 5th percentile and they're doing just fine. But if they're not able to stay on their curve, if it drops off, that would be concerning. I want to remind you as well that one of these red flags, one of these symptoms doesn't mean your baby has obstructive sleep apnea. The pattern overall matters. And if you are concerned, it's worth exploring. So if you are going to explore this, what are the next steps? Well, there are a few, but the first one I will mention is what I think is probably one of the easiest things to do if you're wanting to explore this, and that is to use an online checklist that Little Bird Pediatric Dentistry in Milton, Ontario has on their website. Their checklist is one that I use frequently with clients that I see to rule it out, and I use it in my group coaching program as well. There's also a pediatric sleep questionnaire. It does include some of the items that we would see in snoring, witnessing apnea, daytime sleepiness, hyperactivity, and behavior challenges. It's used in pediatric practices because it's a pretty fast tool to fill out. So it may even be something that your physician has covered with you. So that's the Pediatric Sleep Questionnaire, or PSQ. With the Little Bird Dentistry, it's their self-assessment tool. And I can't tell you where on their website to go for it. But if you browse there, I did look recently when I was giving my Foundations for Infant Sleep workshop to professionals back in November. I double checked that it was still on their site, and it was. Now, we've covered a little bit about why it's important because of that link to attention, focus, learning, and hyperactivity, and that fully 1/4 of kiddos with a diagnosis of ADHD may actually have obstructive sleep apnea. But there are other links to developmental diagnoses that are worth exploring. And one of them is the link with autism. Now, OSA doesn't cause autism, but children with autism have much higher rates of significant sleep problems overall. And some studies show that there is a higher prevalence of obstructive sleep apnea in children with ASD. What that means is we've kind of got this double whammy of more children with ASD will have sleep challenges than those who are not diagnosed with ASD, and they have a higher risk of obstructive sleep apnea. So sorting out what is contributing to sleep challenges if you have a child with ASD is going to be valuable. And of course, that means looking at nutrient status, especially with kids on the autism spectrum, because we know that gut is part of the story. Looking at airway, and then looking at what strategies are going to support good quality sleep in light of any sensory issues or neurodivergence. The broader issues with development, I really want to highlight too, because we all want our kids to thrive and be able to reach their personal potential as human beings. And that means having good quality sleep so that they do have good working memory, good brain health, developing attention, executive functioning, and the ability to take in new information, configure it, come up with creative ideas to use that for. This does have implications on school performance and even on social development, because you can picture yourself after a really poor night of sleep. Your social interaction skills are probably not at their best. And for kids, they're trying to navigate developing relationships. They've already got a great deal of immaturity in terms of their nervous system and their brain development. And so when we add challenges with learning and picking up on social cues and navigating nuance and subtlety because sleep is poor quality, then let's take care of the airways so that we can kind of eliminate some of these upstream medical factors. So what are some practical things that you can do if you are concerned your child has OSA? You've been listening to the red flags and some of the signs that you might see, and you're like, okay, give me the scoop of what do I do next? I imagine that you're overwhelmed. Now you're worried. You're sleep deprived because your kiddo is waking up often, and that part of the reason might be that they have obstructive sleep apnea. So let's think of this as putting some irons in the fire to sort this out. The first is to get a careful history and use a screening tool, whether it's Little Bird, whether it's the pediatric sleep questionnaire. If the way to do that is to go through your doctor, get an appointment with them, talk about the signs and symptoms you're seeing. I do find that when I get parents to fill out the self-assessment questionnaire, I find it helpful as a starting point for bringing it to their doctor so it's clearly laid out what symptoms they're seeing at night, what symptoms with feeding, what symptoms during the day. While you're waiting for a referral to ENT or an airway-centric dentist, there are some things you can do environmentally that support things. One is if there is a lot of nasal congestion, looking at air quality at home, so reducing dust, looking at moisture level, especially I'm recording this in January, so the air is drier than usual, and that can create stuffiness on its own. Having a cool mist humidifier in the room, tracking how humid it is. We don't want it too humid. We don't want it over 50%, but we don't want it down in the, high 20s either. But also looking at position, especially for those kiddos who are now using pillows because they're old enough. If they are using a pillow that's too big or too fluffy or not the right style of pillow for the position that they tend to sleep in, it could be contributing to some challenges with airway at night. Referral to ENT is terrific, especially so that they can look at tonsils and adenoids, look at that airway anatomy, consider whether a sleep study is going to be helpful in adding some data to this whole thing. And of course, I have a soft spot for airway-centric dentists too. There are some devices that can be used orthodontically, I should say, like the Munchie that just helps with the airway position. And then there are also orthodontic devices that can be added to help widen the palate. And in addition to that, I'll add that myofunctional therapy is also something that I think is really valuable because that is about training the tongue, the muscles of the jaw and face to be able to work more optimally. So where's the placement of the tongue? And can we retrain where our tongue is so that it's on suction to the roof of our mouth with that tip of the tongue just behind the top teeth on the roof of the mouth? If kids are old enough, there are activities to strengthen the jaw. We can look at what types of food may allow a progression of jaw strength and stability. But all this, of course, is a little bit downstream of finding out whether this is a problem to begin with. So to pull that all together in terms of next steps, really monitoring behavior and school performance or tracking sleep. I always say track it lightly. Don't become too obsessed with every minute. But if you can record snoring or paused breathing, they say a picture is worth 1,000 words, but a video is worth 1,000,000. So if you're going to see your doctor or you're working to get a referral to ENT, that video can work wonders for making your story really clear about what's really happening. Filling out one of those screening tools can be really valuable. And then consider that this is very multidisciplinary. So we're looking at potential referral to ENT, a myofunctional or airway-centric dentist, and a myofunctional therapist. If there are other issues, then making sure that you're getting support from people that are trained to be able to support you with particular behavioral supports or learning supports as well. So what are the key takeaways for you before I sign off and send you into the great wide yonder to navigate this if it is something that is of a concern for you? One is if you're seeing symptoms of sleep apnea, like snoring, gasping, or daytime behavior issues, ask yourself whether airway could be part of the story and then talk to your doctor. You don't need a doctor referral to go to an airway-centric dentist. I would just emphasize that having a pediatric airway-centric dentist is key because the issues in pediatrics are going to look very different than the issues for adults. Use a screening tool to support you and to make the story clear for you about what is happening and what symptoms you're seeing. And then draw in the people that are going to be supportive of this, whether it's ENT, airway-centric dentist, myofunctional therapy. I would add even things like osteopath or myofascial release, because when we look at the patterns of movement and the postures that we have that can support a healthy open airway, then we don't want to throw everything in the kitchen sink at it, but consider adding those or considering reconnecting with your osteo or myofascial release therapist. So in closing, if you are concerned after this episode that this is part of why sleep has been a challenge for your baby or child, you have some tools and some solid steps that you can take starting today to be able to find out whether this is the issue and to address it. Take a peek at the show notes because I'll link it to anything that I have available that will make this a clearer path for you to pursue. And as always, if you are looking for sleep support from me as an occupational therapist or sleep coach, I welcome you to book a call. Until next time, I'm wishing you restful and restorative sleep. And if obstructive sleep apnea is part of your family's story, I wish you the best in navigating this and solving it. Bye for now.
Thank you for joining me on this episode. I do hope that you found the information and perspectives in this podcast episode helpful to you as you navigate your baby's sleep development. Of course, this podcast provides general information and it isn't tailored to your family's reality or the specific needs of your baby. If you're concerned about your baby's sleep or health, be sure to reach out to your healthcare provider. If you're feeling exhausted and overwhelmed and you need a place to feel nurtured and reassured, you can find me on Instagram at familysleep.ca. Until next episode, look for the connections that support you and your baby.